something a lot of times that's not checked by a doctor when you come into their office dealing with foot pain, especially foot pain that hasn't gone away in a long time, whether it be weeks, months, or even longer, even years, are vitamin deficiencies. When your body isn't getting enough of certain key nutrients, it can lead to problems being able to heal or maintain nerves, muscles, tendons, ligaments, bone. Who am I? My name is Dr. Tarr. I'm a board-certified podiatrist, currently in practice in Phoenix, Arizona, and I own a small practice, Direct Podiatry Arizona, and here are the 4 vitamin deficiencies that can cause foot pain. So the first vitamin deficiency that can cause foot pain is vitamin B12. So in the discussion of certain vitamin deficiencies that can lead to foot pain, B12 is definitely one of the more common ones. The job of B12 in your body is to keep your nerves healthy. B12 actually plays a part in making red blood cells, and your red blood cells are responsible for bringing oxygen or carrying oxygen throughout your blood and to other parts of your body. When B12 is low, nerves that were once healthy will start to break down, and this is known as neuropathy. Symptoms of neuropathy can include numbness, tingling, and burning in your feet. Over time with neuropathy, the muscles in your feet can actually become weaker and they can shrink, known as atrophy, just because they're unable to get healthy, normal signals because of the nerve damage from the low vitamin B12. So if you don't use it, you lose it, and that is very true with the body. This can make it a lot harder to walk or stand to keep balance, and this can actually increase your risk of falls. Vitamin B12 levels that are left in a low state can lead to permanent nerve damage and chronic pain. So there's a lot of things that low vitamin B12 can do in the body, but specifically what happens to the feet. When it comes to red blood cells, low vitamin B12 means that you won't be making as many red blood cells as you need, which means your body potentially isn't getting the level of oxygen that it needs. And in the foot, this can lead to degenerative changes. It becomes harder to heal from injuries, and this can lead to foot pain over time. People that are at increased risk of developing B12 deficiency include vegetarians and vegans, just because B12 is found on meat, dairy, and eggs. B12 is specifically made by a bacteria found in these food groups. So excluding these food groups or cutting down on them significantly can increase your risk of developing B12 deficiency. Older adults over the age of 60 are at higher risk of developing B12 deficiency just because your digestive system becomes less efficient over time at breaking down food and being able to absorb that B12. People with digestive issues like Crohn's disease or those who have had stomach surgery also are at increased risk. So for these groups, it's recommended to supplement your B12 to lower your risk of developing deficiency. So the second vitamin deficiency that can lead to foot pain is vitamin D deficiency. Vitamin D, again, is one of these vitamins that is critical for human health in so many different ways. Vitamin D is key for making bones, repairing bones, regenerating bones, healing from broken bones. Vitamin D also has anti-inflammatory properties and antioxidant properties. Vitamin D, similar to vitamin B12, also is key for healthy nerves, and vitamin D is crucial and central to a healthy immune system. Vitamin D also supports healthy muscle function. Healthy vitamin D levels also can lower insulin resistance. Vitamin D is made by our bodies when our skin is exposed to sunlight. Vitamin D also can be found in certain foods too, like cod liver oil and fatty fish. But unfortunately for the average person in the United States, the vitamin D levels are lower than normal. One of the key effects of low vitamin D levels are bones that are easily broken. So story time, I did my residency training in Cleveland, Ohio. And if you've ever been to northeastern Ohio or really any of the cities on the Great Lakes, you know that winter can be very brutal, very harsh. A lot of times Cleveland can be overcast for 6 months out of the year. Because of that, it's definitely more common to have lower vitamin D levels. I had a patient, it was around Christmas time, that came in. She had taken a fall from a step and she had broken one of the bones in her foot. But because the bone wasn't in a good position, she needed surgery. So one of the things that my attending and the attending physician is basically when you're in residency, This is the doctor that you work under. He ordered a vitamin D level on her because, again, Cleveland and wintertime, and her vitamin D was 11. Normal for women is in the low 30s. So we supplemented her aggressively and then eventually took her to the OR to fix that broken bone. Low vitamin D levels can actually make other causes of foot pain worse or other foot problems like plantar fasciitis. So if you're someone that doesn't spend a lot of time outdoors, if you work night shift and just don't have a ton of sun exposure, it's worth your while to be mindful of your vitamin D. And especially if you have darker skin and you live further away from the equator, this is definitely something to keep in mind. Just because, yes, darker skin and melanin is protective from sun damage to a certain degree, but because of that, we have to stay in the sun longer to make the same level of vitamin D that someone with fairer skin does. Just something to keep in mind. So the commonly recommended 15 to 30 minutes of sun exposure a day is a lot more for someone with darker skin, especially if you're not on the equator or close to it. Other groups at risk of being vitamin D deficient are seniors. And then the third vitamin or nutrient deficiency that can lead to foot pain is vitamin B6. Vitamin B6, also critical to nerve health, just like B12. Deficiencies are more common in seniors. Vitamin B6 is also important at controlling inflammation and making sure that your muscles work as they should. On the flip side, vitamin B6 levels that are too high also can lead to nerve damage. And the fourth and last on my list for vitamin deficiencies that can lead to foot pain is vitamin B9 or folate. B9, commonly known as folate, also has a role in making red blood cells, and as we learned earlier, red blood cells are the cells in your blood that take oxygen to the rest of the parts of your body. Folate is also really important for nerve health as well, just like B6 and B12. Folate is found in many foods like your leafy green vegetables, beans, and fruits. Low folate can cause a lot of different issues in the body, but specifically in the foot, because folate is one of those vitamins that's important and required for making red blood cells. If your body doesn't have enough folate, your foot more than likely isn't getting the level of oxygen it needs to repair, to maintain itself, to be healthy. And that can lead to foot pain over time. Unfortunately, vitamin deficiencies aren't as commonly considered when someone comes in with foot pain, especially foot pain that's chronic, foot pain that's been around for a long time. But this is one of the things I believe that should be addressed. Again, it's important to remember that your foot is connected to the rest of your body and that a lot of times nothing in the feet happens in the vacuum. Health problems that you have going on a lot of times will affect your feet too. And sometimes those signs, symptoms will show up in your feet first before they show up in another part of your body or as another symptom. This is my goal as a foot doctor, as a podiatrist, to get to the root cause of your symptoms, why you're having foot pain. Vitamin deficiencies, hopefully as you learned today, can play a major role in why you're developing foot pain in the first place. If you're someone that's been dealing with foot pain for a while, definitely find a foot doctor that's well-versed in looking at your body as a whole and looking into things like vitamin deficiency to see if that is one of the several factors that are playing a role in you having foot pain. So that is it, folks. My top 4 vitamin deficiencies that can lead to foot pain. Let me know in the comments below. Have you had a foot issue, foot pain that you later on realized, or maybe a doctor realized was caused by a certain vitamin deficiency? How are you doing now? Are you better? Is it something that you're still working on with supplements, with diet changes? Let us know in the comments below. If you like this video today, like, comment. If you would like to see more content from me, subscribe, and be sure to hit that notification bell so that you'll be notified whenever I post a new video. A link in the description box below will be to a blog post on my practice website, Direct Podiatry Arizona, on this topic. There will also be a link to my email list. Feel free to sign up. You will receive weekly emails from me on blog posts that I write. So until next time, everyone, take care and have a great day. Wish you well.